Welcome to another session of Inside Washington Hospital. Today we're going to examine Washington's implementation of the lean management system. The healthcare landscape is changing across the country as it becomes more and more difficult to run a high-quality healthcare system and keep costs down. By adopting the lean management system, we have found a way to accomplish these goals while keeping our patient-first ethic at the forefront.
Well, lean has been around for about 100 years, primarily in the manufacturing industry. For the last 15 years, it's been used in healthcare with great success. Lean management is important because when our patients arrive at our door, we want to make sure that they have the best patient experience as possible. We want to ensure that our patients are able to visit with their physicians, not have to wait a long time, and to spend more time with their care provider.
What is unique about the lean management system is that it actually focuses on two core principles. First, continuous improvement, and second is respect for people. So some of the key terms when we talk about the lean management system actually begin with some of people's favorites because it's one of the Japanese terms that's easy to say and fun to say. That's Gemba, and Gemba is where the actual work is done.
So going to Gemba means going to the actual place where we provide patient care.
When visiting and evaluating the Gemba, it is important for the team members to physically observe the process in order to discover the root causes of delays and defects, and to also understand what countermeasures may work to solve the problems.
Many times we sit in conference rooms or in our offices and we discuss how patient care is being provided. However, it's not until you go to the Gemba when you realize what truly is occurring. And so being in the Gemba allows us to accurately observe how the care is being provided for our patients. Lean really follows a standard documentation. We often call it standard work, and really it outlines the steps that you need to be successful.
Sometimes it seems like a lot of paperwork. We're writing all the standard work. We're trying to time the standard work and really understand the sequence of the steps. But really, without standards, there can be no improvement. So once you write standard work, then you can improve upon that. And so your standard work is the best we have today, but then you know you can improve upon that, and it's a continuous process. And then that leads us into Kaizen. So Kaizen, obviously another Japanese word, but Kaizen is actually two words together. So Kaizen means continuous improvement, but literally translated, Kai is to change and Zen is to make better. So literally it means to change for the better.
Continuous improvement has been part of a number of programs that have existed at Washington in the past. It isn't just particular to lean, and the idea is that as quickly as you have accomplished a lean process and are beginning to reap the benefits of it, you have to go back and look at it again. It's kind of like painting the Golden Gate Bridge. You start at one end, paint the bridge, and then it's time to start again.
Our goal in using the lean management system is to focus on the patient perspective and improve processes. By eliminating waste or eliminating activities that don't add any value, we'll be better able to make the patient experience the best it can be. Just as important, the system is designed to help streamline workflows, eliminate unnecessary steps, and generally make things easier for those who do the work.
When we're focusing on Kaizen improvements and eliminating the waste, one of the things that we do as we eliminate is we really are trying to make all of our employees scientists. They're actually doing problem solving as they're doing this work. You actually look at where are the possibilities for improvement. How can we actually decrease the waste from the patient's perspective so that it improves their quality and safety?
Visible improvements are hard for the patient to be able to see. Really what we're aiming for is the feel that our patients have when they come to Washington Hospital. We want them to feel that they are really cared for. We want them to feel that they are not waiting a long time and that they are able to spend more time with their care providers. So it's not necessarily, they may not notice it from the eye, but they should feel it from the way that their care is provided. In terms of our hospital staff and physicians, they are more able to notice the changes because we really focus on making sure that the providers have what they need, when they need it, and that the process for providing care is more streamlined.
Lean has a concept of waste called muda, and that's Japanese for the word waste. And they look at things that are built into the healthcare service industry very differently than historically they've been seen before.
If there are questions, so we have Tricia, Ranjana, and Bill in Central Reg.
So when we're doing Kaizen work, improvement work, we're trying to understand always first from the patient's perspective, where is the value added? Where is the waste that we can eliminate? And there's actually 7 deadly waste, we call them. So 7 wastes that we want to eliminate. And they are transportation, inventory, motion, waiting, which is something that patients find very difficult to do. And then there's overproduction, overprocessing, and my least favorite, defects. The other thing about that's so compelling about the lean management system is that it's the people that do the work every day that need to be engaged in the improvement processes.
Lean management really works because instead of management telling staff what to do, we really go to the staff that do the work and ask them to come up with the ideas for improvement.
In this methodology, it's actually the people who are doing the work day to day that get to say, this is how I want to improve the process. And when you see people involved in that whole searching for solutions, it's really exciting to see the light bulb go off when they say, yeah, this is how I think it should be done, and it's possible that's what we're going to do.
I like the lean management system itself because you're able to test ideas and know whether they work or not, and you can adjust them.
Second one is Dr. Saxena said she does not get results right away, so she sends to NorCal.
When we do workshop, it only takes about a week to test those ideas, and you can see result by the end of the week.
It works because the people that are doing the work, the clinicians, the leadership, the staff, begin to understand that it really is changing their patient satisfaction, it's changing the work that they do, and they begin to change their behaviors, which then changes the culture, and then you see it actually working.
When you sit down to go through a lean exercise, the people in the room have all parked their official titles at the door, and you have a mix of physicians from the medical staff, management, executive staff, hourly employees, all sitting together working on a common problem and developing a common understanding of what that problem is, and then coming up with solutions together. It is a process of fundamentally altering how people do business in the hospital.
Scheduled for after the needle load.
When we come back, we'll illustrate just how the lean management system works and take a look at some potential improvements and some we've already made. Actual practice of the lean management system begins with the creation of a value stream map, or VSM, for a specific area or process.
Value stream mapping is the process of following a patient through their care here at Washington Hospital. Whether they're having a service provided or a procedure, our team of physicians and staff follow the patient to make sure that we're able to document the steps it takes to provide the care.
Lean gives us a great melding of both methodology and tools that help us really identify what waste is. One of the jobs of the Kaizen teams is to go out to the workplace and look at what's happening in the workplace that might be considered waste. And when we go out to the workplace, we really try and have big eyes, big ears. We don't talk, we just observe. And we watch how people do their jobs and look at the ways that we think they could be doing their jobs more efficiently, write them down on little Post-it notes, and then use the lean methodology to characterize those wastes.
Once we have the steps documented, we create what's called a current state map. A current state map really is all of the process steps it takes to provide the care. We then look at the current state map with the goal of trying to find ways that we can improve the process and reduce wait times. Once we have a current state map, we then develop what's called a future state vision. The future state vision really looks at what can we do in 3 to 5 years? How can we improve the process? And once we have our future state vision, we develop what's called an implementation plan. And the implementation plan is our way to make it to that future state map. And we really focus on the first 12 to 18 months and what we can do right away to improve our patients' care.
let's look at some specific ways the lean management system is already improving value, eliminating waste, and benefiting you, the patient, here at Washington Hospital.
My name is Michael Plasbecker. I'm the ER manager, and I was one of the first executive cohorts to take the lean training. We did an analysis of one of the bedside nurses, and basically the nurses were walking back and forth for each patient to get supplies they needed, routine supplies, so they were wasting a lot of steps, and you can tell how many steps I'm taking here. If you multiply that by 20 patients a day, that's a lot of steps. Yeah. So as an offshoot of that, we decided to deploy the bedside carts at each room. So the most commonly used supplies would be readily available for the nurse, and he or she would not have to walk as far, be more efficient, and provide more face time with the patients. It was 6,000 steps in 4 hours for the nurse assigned to this area, rooms 5 through 8, and dropped it by half. We purchased these bedside carts, put one in each room, and selected what items they were used most frequently. And then we looked at the inventory that Oscar maintains downstairs, and we came up with what needs to be here. They developed what they wanted with some spatial constraints. They developed the stuff they used most frequently on top and the stuff they used least frequently on the bottom. Again, there are a few things on the bottom they use frequently, but by size they can't fit on the top. And then the EMT was pivotal in designing this because we labeled each one of them. We have the clear plastic dividers here so that you can instantaneously, without counting the inventory, instead of going through 1, 2, 3, 4, 5, 6, you can just look at how it's supposed to be filled to the top. It allows the nurses to spend more time, maximize their time with the patient, which is what the patient's really here for. They're here for direct care. They're not here for nurses running around, again, grabbing supplies. And this allows the nurses to be more efficient, which utilizes their time better. And it's also better for inventory control. It's a visual signal for the EMTs to restock so they don't have to count and take their time as well.
Is that why it's going back up?
No, that's why we replaced that drain. So she has.
So the no delay huddle came about because we were trying to get the handoff of the nurses, the vital patient information. Historically, it's been a verbal handoff, 2 nurses on the phone talking, and because of the different requirements they have on the floor and things they need to do, sometimes that wasn't possible in a time-efficient manner. The ED nurse was busy when the floor nurse was ready for a report. The floor nurse was busy when the ED nurse was ready for a report. Sometimes that occurred at a delay of 30 minutes, which is no value added time for the patient's perspective. They retooled the handover tool within, so the process is such that the bed control person assigns the bed with the charge nurse on the floor, then tells the nurse they should expect a patient. That nurse goes on and looks at the various information that's available for the handoff. If they have any questions, they call the ED staff. The ED staff at this point gives a courtesy call when the patient's coming up and explains any other information, vital information that's not contained in the report that the floor nurse feels they need to have. The modular building is obviously outside of the main ED space, but it is where we do our triage and waiting room functionality. Historically, we did the nurses manned that area. However, the nurses were triaging the patients at the same time, and sometimes it became difficult for them to keep up with the patients coming, visitors coming.
Good morning. How can I help you? You need to see the doctor this morning?
Yeah, I have a searing pain in my arm. I think I might have broken it.
Okay. I need you to fill out this form for us this morning. Have you been here before?
No.
So as part of our arrival registration workshop, we designated a registration clerk to man the window, and that registration clerk greets every patient, and that way the patients don't wait. Patients are seen appropriately, and they arrive the patients in the computer, which assure the accuracy of the patient information in the computer.
Okay, Tori, why don't you come on in?
It also allowed the nurses to manage the triage better and the flow of patients better through triage because they weren't interrupted doing clerical activities. And our satisfaction has steadily increased since the implementation of that workshop.
We'll be back after the break to examine how the implementation of the lean management system affects the residents of our district and supports our patient-first ethic. The advantages of increasing value and reducing waste at Washington Hospital results in benefits beyond the specific departments and individual activities. The effects of these changes are felt not only by our patients, but by the residents of the district as well.
Lean is a system that really works well to improve patient care, and I think it does it both from an individual standpoint and an institutional standpoint. So from an individual standpoint, as patients, we all want an experience where we're not waiting, our time isn't wasted, where most of our time is spent with our clinical providers rather than waiting for them to look at the computer or go find something that they don't have. So Lean is really a system that optimizes those processes so that we get that patient experience. From an institutional standpoint, it's really about optimizing our systems so that our processes help us provide the highest standard of care. It's really about defining what is the standard and having everybody work to that standard.
Lean management is raising and developing people. It is believing and trusting the people who do the work, know what the problems are, and given the right support, they will make that valuable improvements.
Many times when you're implementing a new project or process, it takes many months and sometimes years to actually come to fruition. With Lean management, we're able to see change within 5 days. And so it's really excited to be part of the change to improve the process for our patients. We really value our patients. We have a patient-first ethic here at Washington Hospital, and it's great to be able to provide such a wonderful service for our patients and to constantly be improving it.
All right, we'll use your good arm here, okay? Any recent travel outside of the country?
I think the most overarching value of Lean has been the focus on the patient experience and providing the most quality patient-centered care that we can in the most efficient mechanism possible, increasing patient satisfaction by decreasing ED wait times from our perspective, and providing care in an economic, responsible fashion to the district residents. From my vantage point, I think the Lean management system has been a positive endeavor. It's a cohesive and a collaborative endeavor, and it's brought a lot of divisions and groups together to work on a common goal, and that's to provide the best patient care possible.
The thing that really excites me about Lean is that I feel that it is a comprehensive approach to quality care. There are lots of quality initiatives that have happened across healthcare in many different areas, but I think Lean really brings that together, and it's one approach that not only touches efficiency, but really builds quality into our processes, and that to me is really exciting. The last thing about Lean that I think is really important for providing high-quality patient care is that it's really a model for continuous improvement. So Lean is not just about going into one area, correcting that, and then you're done and moving on to the next area. It's really about keeping focused on an area, thinking about continuous improvement, keep thinking about, okay, you have a great process, but how do you take that and improve it even more? And so it's really a lifelong journey for the hospital.
Well, Lean management system is a good fit to Washington Hospital because our focus is always the patients, and we do this continuous improvement to aim for that perfection, to continuously improve our processes.
With the advent of the Affordable Care Act, the amount of money coming into the healthcare system was clearly going to change radically. It was very clear to me strategically that the hospital needed to become the highest quality, lowest cost provider of hospital services in order to survive in the New World Order.
All right, you're okay to walk back to see the doctor?
Yeah.
Okay, why don't you go ahead and follow me, we'll get you back, okay?
Well, the hospital is a public trust, and I believe that we are duty-bound to operate it in the most efficient and cost-effective way we can, yet still providing all of the services that they need. And Lean is a vehicle for getting to that place. And so I think that it is very consistent with the concept of a public trust and being accountable.
As you've seen, the Lean management system gives us an excellent opportunity to make a positive difference at Washington Hospital right away and also long-term. And the gains made will be felt by everyone at Washington Hospital, by the patients and their families, and by the community we support. Thanks for watching. I'll see you next time on Inside Washington Hospital.